sure to keep an eye out at Smooth 981 across all platforms. But we're talking about the Nigerian health sector today and its influence basically on today's medical practice. And I have a special guest who I'm going to introduce. Now, our guest is a public health physician. He's a public health programs coordinator, administrator, and physician for the Lagos State government. He earned his medical degree in 2010 and went further to get a master's degree in international health management from the Imperial College in London. He also received training from the Liverpool School of Tropical Medicine and the Harvard School of Public Health. Now, with insights into healthcare practices, policies, programs in developing countries, Dr. Tolu Ajomale has designed and implemented public health strategies and interventions. He's also very efficient in project management and has helped implement programs since he joined the Special Projects Unit of the Lagos State Ministry of Health. Welcome, Dr. Tolu Ajomale.
Good morning.
Good
Good
morning.
morning, Lagos.
Very lovely to have you on the show this morning.
Very excited to be here as well.
Okay, so let's start with the state of healthcare in Nigeria. Can you give us an overview of the healthcare sector as it is at the moment?
Okay, so I think it's a really difficult question to answer, and a lot of times, when you ask those who are either administrators or government functionaries or those who are care providers, everybody gives you a different definition or perspective on how it is. Sometimes some have described Nigeria as having 37 health systems, right? Each state having its own health system, and then Abuja having its own health system. And the nation also trying to have a health system that unifies all these health systems. And each health system is relatively peculiar, even though they share the same building blocks like all the other ones. And so the kind of services you would find available in one state will not be the same you find in another. The kind of regulatory framework you'd find in one state you will not find in another. And so there's an inequity in the distribution of workforce, there's an inequity in the distribution of the quality of care, there's an inequity in the distribution of demand for service as well, because, and access to care, because some states would begin to focus more on health insurance to finance healthcare, and other states are still, struggling with out-of-pocket payments for their citizens. Primary healthcare in some states are more functional than others. Some states have better general hospitals. Lagos has a very robust private care system that is not really available in most other states. So you find that diversity across board in the country. And that diversity, of course, has its implication as well when you're trying to measure health outcomes. Because at the end of the day, it really isn't just the availability of the services, how healthy is the population. And that is what drives a lot of, the services or policies or regulations that exist in the country.
All right. And I want to ask this though. The healthcare sector certainly has its challenges, like possibly
Yes.
every other sector across Nigeria. What are the challenges that you consider as the most pressing?
So we can look at that in two perspectives. We can, look at it from the demand side, from those who are seeking healthcare. And you can also look at it from the supply side, those who are providing healthcare. Now, from the provider's perspective, we are going to be looking at things like the human resources for health, those who are going to be in the hospitals providing care. We have a huge gap in skilled professionals in the country. So now, when we speak about that, there are two things that will come to mind. One is the availability of specialists to handle different, aspects of healthcare, like nephrology, neurology, psychiatry, and things like that. And then there's also the general distribution of healthcare workers. How many nurses to a patient? How many, general practitioners to a patient? How many laboratory scientists are available to a patient? And then you're also looking at things like what kind of the quality of medication is available to people, right, from the supply side, and of course equipment, diagnostics, and things like that. From the demand side, there are also challenges with people being able to access healthcare. Someone once said that most people are just one illness away from catastrophic health expenditure. And that largely means that there's just one sickness that is hanging that can make a person who is relatively comfortable to become very poor. And that has a huge implication in itself. Now, there are two things to that. It means that one, they're able to pay for the care when it is available, but the care that they're paying for is too expensive for them to afford.
Mm.
Or two, they can't even pay for that care here, so they have to look for ways to get the patient to where the care is available, which also has its cost implication as well. And then there's, of course, the concerns about quality of care, distribution of care, access to those services. Um, there's still a huge availability of traditional healthcare workers that the health system is still trying hard to try and see how they can integrate, improve the quality of the services that they offer, because a lot of people still, patronize traditional healthcare providers. So the struggles, the challenges are numerous. Workforce distribution, challenges with producing the health workers from schools, challenges with ensuring that you have good qualitative drugs that are affordable, challenges with ensuring that you have enough bed spaces in hospitals for people to
Mm.
be admitted to see their doctors, challenges with people being able to pay for care in those services. It's huge. It's a huge mess, and as you try to fix one, others will rear their head and becomes really interesting to try and work with. But when you see some gains, you're encouraged to actually do a lot more.
All right. I want to ask this because in recent years we've seen a lot of healthcare workers, not just doctors, but nurses and people in imaging in laboratories. They're moving to different countries,
Yes.
and I'm just wondering how much of a concern is brain drain?
So, you know, people have come up with different terminologies for it, and I think the reason why that happens is because it isn't the first time this is happening. Some have described it as a cyclical event. I listened to a professor speak a couple of weeks ago where he said that the first time that this was, large enough in scale
Mm.
to cause concern was in the 80s when there was a pandemic of HIV in the US. And a lot of the health workers there and in some other countries were finding it difficult to be able to manage, the disease and manage patients, and they were scared and they were backing out. So they needed to get other health workers from other places to be able to fill in that gap. And so they went out, created a new policy that allowed for people who were outside the country to come into their country to practice after filling out certain regulatory requirements. And then it happened again when, Saudi Arabia needed doctors and they put them on a contract. So what happened in that instance was that they used older doctors who they put on a termed contract. So they were probably coming to Saudi, earn lots of thousands of
Mm.
dollars and work for maybe 3, 5 years and then go back to where they came from. Now there's another cycle that came again now with COVID because there was now also that huge, gap in care providers for, managing COVID at the time. And a lot of those who were practicing in those countries were resigning because they couldn't deal with the fatigue and the stress, involved with it. And so they decided to do the same approach again and then open up their doors to recruit health workers. And because health is, and practicing healthcare itself is universal. So essentially, the training you would get in Nigeria is going to be the same training you would probably be required to get in the UK. The only thing
Mm.
you would need to do differently is just make sure that you write exams so that you qualify to be licensed to
Okay.
practice there. And because that is possible, it allows that fluidity in movement for health workers across borders in different places.
Mm.
The only thing that makes it different is what incentives are available. So there's the description of that pull and push effect. So the pull effect is the countries where they're migrating to, creating policies that attract the healthcare workers to come there. But there's also the push effect of where the healthcare workers are and what is driving them out of that system to go to somewhere else to practice.
Right.
So that push effect is not necessarily financing, because we've had conversations with a lot of health workers. The issues aren't really only that they need more pay. They're also struggling with the same issues everybody's struggling with:
Mm.
security for their children, for themselves, better education, being able to afford the basic necessities of life. And so they see that opportunity of not just earning more, but having those things available to them. So they jump on that opportunity to move there. But then, even those other countries where they go to, they are now also trying to create new policies to restrict the number of international medical providers that come into their territory because of their nationalistic concerns and philosophies, and how they're also trying to say in the long term they need to be able to build their own workforce and have their own doctors and their own. And we also need to also focus on that as well, and try and see how we can retain our health workers. But it's not new. It's just interesting to see how history repeats itself, just
Right.
with slight amendment in the strategy and the way it's implemented.
Okay. Well, we're speaking with Dr. Tolu Ajomale, and as always, I love you to be a part of the conversation. So if you've got a comment, you've got a question, please send them through. The WhatsApp number is 0809 440 You can also tweet at Smooth981. And we're streaming this live as well on YouTube. So just go on YouTube and you will find us. It's Smooth981. And you can also subscribe so you don't miss further live streams of our shows right here on Smooth. Well, it's time for us to take a quick break. And when we return from that break, we'll talk about the relationship between healthcare workers, their patients, and in some cases, their families.
Yeah.
That conversation will happen right here on Lagos Talks and Smooth 98.1. Okay, so we're back in about a minute.
No
Yes.
worries. This thing has a name, right?
What's that?
This scheduling thing. What's it called?
This?
Yeah.
Okay, it's RCS.
Oh.
Yeah, it's like a program. Yeah.
And then you have people who will pay for adverts, and it's supposed to come up at specific times.
Yes,
and you have
yes.
people who are monitoring to make sure that
Yes.
adverts come up.
It's a whole system. In fact, yesterday I went down to the engineering team and actually took a look at everything, how sound is done. And the lead engineer was like, you know what, no presenter has ever done that. But I actually enjoyed it because there's a whole lot that goes on to just, exactly make everything come together and sound nice.
And, it's just interesting to see how that happens, because those are the guys that are doing all the work to make sure your voice is heard.
That's
But
true.
people listening only hear your voice. And these are the only people that are there. Everybody else
It's
does
also
not.
like in your sector, right? So people think of doctors and nurses, but there's a whole
Lot.
team.
Yes.
Wow, amazing stuff.
And of course, if anything goes wrong, you also have to take the flak for it.
Yes, like unfortunately, some doctors have been.
Yes, they have.
Is it okay for us to talk about the unfortunate incidents in Asaba? Okay. Very strange times.
I mean, it happens all the time, but it's just unfortunate.
I know. This is Lagos Talks on Smooth 98.1. It's Zibby here, and my special guest this morning is Dr. Tolu Ajomale. He's a public health physician. He is a public health programs coordinator, administrator, and physician for the Lagos State government. Now, as always, please be a part of the conversation. 0809 440 or just tweet at Smooth981. Dr. Tolu, I want to talk about something that seems to be happening more and more. Its frequency seems to be on the increase, or maybe people are just speaking about it a lot more than they did in the past. Now, just a few weeks ago, on New Year's Eve, there was an unfortunate report of a young doctor who had lost his life in Asaba. And, at first the NMA had released a statement saying this was as a result of being attacked by family members of a patient that he'd attended to. And a few days later, the police said he was attacked by cultists and it happened in hospital. Now, while I'm sure investigations are still ongoing, he was attacked while working. And on social media, I read reports from different doctors who shared some rather horrific tales of being verbally and physically assaulted, by patients and sometimes even their family members. And I'm so curious about this. Why is this happening now, and why is it on the increase?
Right. So I wouldn't say it's just happening now, and I think it's a huge concern that a lot of our healthcare workers have had for many, many years. Now, you would also remember that there were also times when people who had gunshot injuries would be taken to a hospital and the doctor would insist on getting a police report before they attend to them, because they've also in the past have tried to help such patients and they got arrested by the police for doing their work of trying to save life. Now, even when you take that out, like the federal ministry and I think the police have acceded to allow doctors to treat,
Mm-hmm.
and while in the course of treatment do all the other things they need to do, there's still that concern for the safety of the patient, or the safety of the doctor or the nurse or the other healthcare workers that are present there. Now, generally speaking, within every hospital system, the healthcare workers that are most at risk of violence are those who work in emergency. Because, on one hand, from the family's side, you have people who are very apprehensive, who are full of anxiety, and
Mm.
they're bringing this person and they expect you to do, magic in quotes, and ensure that the person survives. Even when the person comes under very difficult circumstances, very poor prognosis, very poor possible outcomes, and the doctor still tries to do their best. But at the end of the day, you find that because the patients are grieving, they find an outlet for the expression of that grief. And unfortunately, a lot of people express that grief with anger. And they say, oh, you didn't save this person's life because they feel that you didn't put in your best.
Mm.
And then the doctor and the nurse become the victims of a lot of things that happen. I also found one report of something that happened a few months ago where a patient was taken to a hospital. The patient had passed away
Mm.
by the time they got to the hospital. The doctors had seen, the nurses had seen that the patient had passed away with the normal processes, pupillary dilation. There was no heartbeats. They had checked the pulse. There was nothing, and they had informed the family that this person had passed. But the people who brought them were still in the state of grief and anxiety and fear that,
Right.
oh, something can still be done, and they continued to try and do something for a patient that had already passed. And then they said, oh, the healthcare workers did not help them to resuscitate the person, even though they had informed them that the person had passed, but they didn't believe it.
Mm.
And so they now started castigating the healthcare workers. They were saying, oh, that's how they always do. They don't do their work, blah, 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 and all of that. Understandably, people are in a state of grief, and so they don't want to believe the news of someone passing.
Right.
But I think also we need to be a bit careful as well when we try to do some of these things. One, we're already very short staffed in the number of health workers that we have. They're already an endangered species in quotes. And then when they have to come and do the work that they need to do, it is also difficult for them to do that under current working conditions. But they still try to thrive to do that work. And then while still trying to do that, you now also bring threats to their life and well-being. That does not encourage anyone to want to continue doing that work. Some hospitals will try to create measures in place, like put security posts at the hospital entrances to dissuade people from carrying out any violent practice. And there is even a law that protects the healthcare worker from attending to a patient when there's actually a threat to their life,
Okay.
right? But while those things exist, there's no doctor or nurse, out of good conscience will say that, oh, because you appear to be aggressive, I will not do what I need to do to save this patient's life, because they're also committed to their oath of trying to
Mm.
provide care. So it's a very fine line of but that requires a lot of understanding on the part of patients, family members, and also a lot of empathy for them, for the healthcare workers who are doing this job, but also on the part of the healthcare workers as well, to create better measures of communicating, I think, with family members about either the passing of their loved one or the current state of that loved one, to be able to manage the expectation of their family members, as to outcomes. Is I think is one of those things they used to say in Nigeria, and I think we say it a lot in the Nollywood movies, where we say, oh, we care, but God heals.
All
Or we say, oh,
right.
we will do our best, but it's only God
Mm.
that can. But you also find that in other environments where they are a little less, you know, religious driven or faith
Mm.
driven, they would say something like, oh, we will do this. This is the outcome we're expecting, or this is the best that we can do. It is left to the patient's body to respond appropriately.
Right.
So that also manages the expectation of the family members. Say that, okay, they've already explained to us the entire process of care for this patient and what we should expect. If it gets better, great. If it doesn't, we know that this is what has been explained to us. And so there's that understanding
Mm.
about the pathway of care that the patient is getting. And it can also help manage the response when things happen to those patients. And I think it's important that we be able to become more creative, and I think be more serious about the way we communicate that information with our patients as well.
It's amazing because you answered my next two questions before I had a chance to ask them. I was going to talk about empathy on the part of healthcare workers and
Mm,
communication as well, effective communication
yeah.
between all parties involved. So thank you so much for that. Now, I was reading a report about this, and that report was done in the US, and it said about 80% of healthcare workers have reported being abused either verbally or physically
Yes.
in the course of carrying out their jobs. And it also went further to state that most of those attacks, I can't remember the exact percentage now, were against younger doctors
Yes.
and female, younger healthcare workers and female healthcare workers.
Mm.
Is there a lack of confidence on patients' parts in the abilities of perhaps younger doctors?
So I think there are different ways we can look at that. For there's a general perception on the part of patients that when they come to a hospital to see a healthcare worker, if they see the healthcare workers being someone that is older, more mature, there's also a sense that the person is coming with a lot more experience.
Mm,
And of course, the way they would relate with that person would be very different from when they meet with a younger health worker. Now, the younger healthcare worker may be better skilled, right? More knowledgeable, but may not show the kind of maturity because there's no gray hair on their heads that the patients are looking for.
mm,
And so there's some concern about their level of capacity to be able to provide care for patients. But I think that, understanding is also trying to change to some extent. For the female healthcare professionals, I think that is a general gender bias that happens regardless of what sector we're in.
mm.
You would still find people who will come to a hospital and see a female healthcare professional and say, "Oh no, I don't want a female doctor
Really?
to attend to me. I want a male doctor because female doctor doesn't really know. Why would a woman come and be telling me, I have your age at home and type at home?" All
Wow.
those very funny things. But you also have people, especially women, who would prefer to see a female doctor because there's this sense that we both understand what
A
I'm struggling
sisterhood.
with. Yes, particularly if it's related to obstetrics or gynecology,
Mm,
and they can relate better and explain better, and the doctor understands better and can also relate better with them. So yes, there's a general gender bias that also extends into healthcare. But someone also tried to give a sort of analogy where they said that when you go to a hospital and you see an older healthcare worker and you rant and complain about the things that you think is going on, even though the healthcare worker things that you're just speaking out of anxiety and what you've probably seen on Google, an older person will probably be like, "Oh, I see. Okay, I hear you. Okay, but let's try this."
mm.
But a younger healthcare worker is more energetic. He's trying to prove to you that he's capable.
Right.
And so he tells you, "No, what you read on Google is not correct. These are the facts. These are the statistics." Da, 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 da. He reads everything out to you, and then he appears to be more arrogant to the patient.
Mm,
Meanwhile, he's also trying to assert, his experience or his capacity to be able to provide the care that you need. So I mean, and that changes as they get older, right? People tend to become more relaxed with their practice. They take what you have to say, they digest it, and they present to you back in a more humane way without sounding robotic
mm.
and just systemic in their approach. I mean, it changes. It's absolutely normal when these things happen. Absolutely normal.
Okay. People have spoken about when they've had to meet with healthcare workers, they felt like the professionals were a bit dismissive
Mm,
of maybe concerns that they had or certain symptoms that
yeah,
they had experienced. So perhaps, I mean,
yeah,
I can see that now from what
yes.
you just.
But I mean, also, if you consider that, say you are a doctor, right,
Mm,
and you're just seeing a patient who probably has stage 3 breast cancer, for example, and you're still trying to, develop a care pathway for that patient to see how they can get some good outcomes from what is going on. And then that patient leaves, right? And then you have another patient who comes in with a cold and he's telling you, "Oh, I've not slept for like 4 days. This cold is really bothering me. I'm sneezing all the time." And you are thinking, "I'm dealing with someone, or I just saw someone who was basically at death's door, and you have a flu that you can just take an OTC and get
mm,
better." And so sometimes because doctors see varying degrees of difficulties of cases, or varying degrees of morbidities, sometimes they can tend to become dismissive as human beings, to say that your problem is not as serious as you think it is, because I've seen more serious problems.
Mm.
But at the same time, I think it also comes with training, because in the course of training, either as a medical student to become a doctor or as a resident to become a specialist, you have seen things, you've seen all kinds of things, and they've taught you in training that you should learn to leave the cases in the hospital
Mm.
so you can go home and get some sleep. Otherwise, if you keep carrying it and get emotion involved in the work that you're doing, you probably will get, exhausted and burnt out quicker
Right.
emotionally, because of all the stress of dealing with life and talking with a patient who was alive today, who was doing well, and you crack jokes and made a bond with, and tomorrow find out the person has passed. Right. So healthcare workers tend to know more people that have died
Mm.
than everybody else.
Wow.
And so there's a need for them to be able to separate their emotions from the work. So sometimes they come off as closed off, as cold, as uncaring, as lacking empathy. But I think it's also their own defense mechanism of also trying to protect their own mental health.
Right. I thought about this while preparing for this show. I said it really can't be easy when um people have to go into work every day knowing that they have to deal with human beings
Yes.
who are ill,
Yes.
who may be dying, or
Yes.
who have died.
Mm-hmm.
So it's really quite a lot. I've got a message, and this is from Abisoye. It's on WhatsApp. Abisoye from Ebutemeta, and she says, "Hi Zibby and Dr. T. In situations like the Asaba case, um, what do you think could be done better?" And the second question, in cases when a patient is brought to the hospital with gunshot wounds or injury and police reports can't be accessible, are patients going to keep losing their lives? Okay, well, the
Hmm.
law has made provision for this, but it does seem like it's not being implemented
Yeah,
as it should.
so of course there are two things. There's one thing to create a law, there's another thing to disseminate that law, to make
Mm,
sure that everybody that needs to know about that law knows it. So I'll start with the second part. Yes, there has been directive from the Federal Ministry of Health really long time ago, from different agencies of government, where they say when a patient comes to your hospital now, the current policy is start treatment. While you're treating, because it's a gunshot injury, the person is not going anywhere.
mm,
You can then, have that process of trying to engage with the police to get the police report and all of that, or get the patient to get family members to get the police report. But you also have the police, on the other hand, who also need to be informed that patients can start getting care in the hospitals. And some of the hospitals have complained that they are aware, they have tried to implement the policy, but then the police station in their neighborhood that they
mm.
have those relationships with are not aware. So when they start treating, they come there and they start arresting them and say, oh, why didn't you wait for a police report, before you started treating this patient? And then they try to show them that, okay, but your government already said that we can't start, and then start the process of engaging. So disseminating the information to every party involved is
Right.
very important. So that is for the second part. For the first part, I think there are certain things that can be done differently. One, we need to be a bit more intentional with the way we build our hospitals. When we construct emergency rooms, there's spaces that patients are allowed to be. There are spaces where family members are allowed to be. There are thresholds that family members are not allowed to cross to get to those patients and get to the healthcare workers who are providing treatment for those patients,
Mm,
so that the healthcare worker can focus on the patient without interruption from the family member. We also need to become more intentional with the way we create the security architecture around our hospital, such that your security people know when there is an aggressive person, and they know what to do when people start getting aggressive, to be able to separate them from the care that you're providing for the patient. Number three, in cases where you are probably in a small community, your hospital is small, create extra exit points. I know that
mm.
people who run mortuaries do this sometimes, when they bring, when people bring, the corpses of their loved ones to the mortuary, and other people come to visit. Sometimes it happens there as well. morticians are also attacked,
Wow.
right? Because people are grieving and they're angry and looking for an avenue to express themselves. So morticians have created back doors for themselves that once they notice that the family members are beginning to get aggressive,
Mm.
they escape through the back door for their own safety. So we also need to create safety measures as those who own hospitals for the healthcare workers that function in those hospitals. And I think if healthcare workers know that those who are their employers have shown that oversight, it gives them confidence to be able to do their work, knowing that the people who have employed them are also going to be watching their back to make sure that they're safe, while doing this work that they're doing.
All right, we'll take a quick break and we'll continue the conversation on the other side. And there's something called the Compulsory Treatment and Care for Victims of Gunshot Act from 2017.
Yeah.
And maybe we'll pull that up later on in the show and just look at the rights of the patients with regards to this situation. Do stay with us. This is Lagos Talks on Smooth 98.1. This gunshot thing, so many people could have been saved if this law was implemented sooner, and if it's still being communicated across to everyone involved. It's
So
crazy.
there's a second part to that. There was another law that provided for free
Yeah.
emergency care.
Mhm.
Beautiful law, right? But when we say free, right, it is free to the patient, right? But the resources that are required to treat that patient, who pays for it?
Right.
So they created a law that says it is free and mandatory that you don't collect money from patients, but they did not
Mm.
create a fund
All
to
right.
reimburse the providers for
Mm-hmm.
providing that free treatment
Yeah.
to those who need them.
Oh.
So sometimes I think that when they create some of these laws, they don't
Mhm.
call the right people into it.
Right. The stakeholders all need to be a part of the
Yes.
process. Smooth 98.1. Love music, love life. This is Lagos Talks. Our special guest is Dr. Tolu Ajomale, and we're talking about everything with regards to the health sector in Nigeria. Let's talk about the threats of
Mm,
strikes, and the most recent coming from NARD, which is the Association of
resident
Resident
doctors.
Doctors. Yeah. We know that there was this rather extended strike that happened in 2021,
Yes.
and there's been a lot of talk and negotiations behind the scenes, and from the 24th of January there's supposed to be a meeting
Yes.
where they will decide if they're going to embark on the strike action or not. Are there other ways that these issues can be resolved without strikes, which of course will affect patients
Mm.
negatively?
Well, I mean, going on a strike action is the right of every employee when they're not, getting their requests, either getting the attention that it requires. And I think that a lot of times we find situations where, well, in some situations, let me not say a lot of times, where the unions would have expressed their concerns to, focal persons in government or the employers to say that these are the issues and we are hoping that you can help resolve. And sometimes because they do not get responses or they do not get answers to those
Mm,
things, that they decide that, you know what, if you will not hear us this way, we will go on strike. So at least that way, when the public hears, you'll be forced to also hear and do something about it. But there are also times, because I've also been on the other side of this conversation, where the unions do not communicate, with the appropriate bodies. They do not have those sit downs, those conversations, or when they have those conversations, I think on both sides, the approach for negotiation is probably still something that requires a lot of work to ensure that people are carried along effectively.
mm,
Because I feel like if you communicate appropriately, set timelines, set deadlines, set expectations, people are more likely to be able to follow through with those processes rather than revert to strike actions. Then secondly, because strike actions are sometimes inevitable, we've had countries where they have amended laws where they allow you to go on strike,
Mm.
but you will still are required to, excuse a certain number of employees who are required to provide at least the minimal level of care in hospitals. So those exceptions are also being, it's one of the things that are also going on in the UK at the moment as
Yeah.
well, where we have, there's a threat of strike as well, which was also very interesting to see when people were
Hmm.
always so complaining about, oh, when they go to the UK, they don't strike there. And they see that it happens
Strikes
everywhere.
are universal.
And it happens in the health sector quite as much as well. And so there are certain exemptions that will be made that okay, we're going to go on strike, but while we're on strike, certain services still be available so that it doesn't impact on patients. Because at the end of the day, when we go on strike to require or to demand for certain things, it is the patients that suffer. Patients die because they don't have access to healthcare workers. And I don't think any healthcare provider is so insensitive to not understand that fact. And a lot of times they try to make those considerations to try and drive or manage how patients are being cared for in the hospitals. And same thing with those who manage those hospitals, try to look for
Mm.
measures to try and protect the patients. So while strikes are sometimes inevitable, there are certain measures that can be in place to protect the health of the patients that come to those hospitals while still trying to get their demands met. Whilst where strikes may not necessarily be required, I think better negotiation processes need to be put forward. Sometimes I also think, and this is my personal opinion,
Mm.
that unions themselves also need to begin to become more innovative and creative with some of the issues that they're bringing to the table. So they can also, and I know that some unions have tried this in the past, where they state what the issues are and then they also propose solutions to it. So, for example, rather than saying, oh, we don't have facilities, we don't have enough money, our hazard allowance is poor, pay us more as a solution. Say, okay, we can now create, okay, this is what we think we can do to ensure that there's financing for some of these issues. And we, as a union, have come together, put together a working committee to be able to develop some of these solutions. And we want to engage with government to be able to see how these solutions can work, what is required from your part to be able to drive some of these things. So I think a bit of everything will come to play depending on what the issues are that are being raised.
Mm.
But the truth of the matter is, if we are still running our health system the way we are, the issues that are being raised now will continue to persist, and government will still not be able to have the funding to be able to meet up with what you know the unions are requesting for.
Now, it's very interesting. I was reading the news from Zimbabwe just this morning, and the government has basically signed into law a bill that makes health workers unable to strike. So, if they embark on a strike, they could face up to 6 months
Mhm.
imprisonment or pay a fine. What do you think of that?
So, health workers will call that a draconian measure. Whilst for the government, we understand that the reason why they're doing that is because they're trying to protect the health of the people. And I think in that country and in some of those communities, that law will get the backing of the patients because it means that at every point in time we have health workers are able to provide care.
Hmm.
But for the providers who have issues that are not being addressed that will require them to resort to going on strike, you now leave them in a very difficult place. And so they decide, okay, you know what, since we can't go on strike and not willing to do anything to fix the issues, then we resign and we move somewhere else to where we are getting better access to care. And then it only ends up fostering more of that brain drain in those
Hmm.
environments. And then the patients who thought the law was supposed to protect them will now begin to complain to government to say that, oh, why aren't you doing anything to address these issues? I think sometimes an absolute law is not necessarily the way to go.
Hmm.
I think the one that the UK and some other countries have adopted is that they can go on strike for, but not for more than I think 21 days, and within which time there have to be measures that we put in place, both on part of government to hold everyone accountable,
Okay.
to see that the issues are properly addressed, and that they go back to work. And then some classes of people have also been excluded from going on strike as well. I think in the UK as well, the police is not allowed to go on strike. I think the transport sector, certain parts of it is not allowed to go on strike. But it means that If you are going to say you cannot go on strike, it means that on my part, I'm going to do what you need so that you wouldn't have to go on strike.
Okay. And this has been a very interesting conversation. I was just about to take a phone call, but it seemed like that call vanished. But you know what? Give me a ring back. You know the number 0144899981. Good morning. Good morning. Speak to us, Adiola.
Good morning, Mr. Diallo. Yes. Mm, mm, yes. Mm, yeah. Mm, mm, great. Thank you very much, sir. Okay, so two things, and I think they're very, very important questions. Um, for the first part, Lagos created a health facility monitoring and accreditation agency called HEFAMA. It was established by the Health Sector Reform Law, 2006, and I know that that's being reviewed at the
Mm,
moment. Now, what that agency is um, supposed to do is oversee the registration of health clinics or private hospitals in Lagos State. Now they have gone, to the point where they have accreditation banners that they put in front of the hospitals that are recognized by them. And so they always encourage people who patronize these hospitals to look out for the Hefama logo in front of those hospitals. It says on it, I think Lagos State Accredited Hospital or something like that,
okay.
and has a Hefama on it. So you would know and have some confidence that this hospital is recognized by the state and is under the oversight of the state. But secondly, the other part I think is really important that you had mentioned was that, insufficient capacity to be able to oversee the numbers of these hospitals. We have about 10,000 private hospitals in Lagos.
Wow.
And so what happened was that they developed something they called a franchising system where they had people who are private providers form part of the body that does the monitoring of facilities.
Mm,
So they go around to monitor the facilities. They have a checklist of things they look out for. And then they either give you a good score or a bad score. When a bad score is given, you're given a letter to state the things that you're required to do. They come back and do a re-evaluation. And when you fail that re-evaluation, sanctions are placed on those hospitals. And then patients are also, given the opportunity to complain and report hospitals to Hefama to say that, oh, they went to this hospital, they have a poultry beside it. It is unbecoming, in that area and for the patient's well-being to
mm,
have, those kind of things existing. Please come and see what is going on here. And the farmer usually goes with an enforcement team to visit those facilities, shut them down when they are against code, and then, put stiff penalties against those who provide care in those places. So there's a lot of work going on, but I think we are getting some traction in that regard. and there's a lot of room for improvement, obviously. Now, for the other part, Lagos State, I think in 2015, established the health financing law. It was the health management fund, Lagos State Health Fund, and under that was created a Lagos State Health Management Agency, which is LASHMA. Now, LASHMA is giving powers by that law to regulate health financing providers in Lagos State, including HMOs. And what they also have capacity to do is also create a health insurance program for those who are in the informal sector. So they also get coverage and do not have to pay out of pockets to get access to healthcare services. The scope of that program is expanding every day, and I know they're increasing the number of kinds of packages that are available that people can take advantage of. And of course, they're a lot cheaper than getting the ones that are available by most private HMOs. The other thing that we try to encourage people is maybe your gate man, your driver, other people who are not under your company's employment, but keep coming to you every day to say that their wife is sick, the daughter is in the hospital. Get the health insurance for them so that covers them as well, and you don't have to spend extra out of pocket. And I think for a family of 6 is 40,000 naira in a year. So you can just check Lashma out. You can Google up their website, and you can find more information about the insurance programs and packages that they have available.
Wow. We're out of time. This was a very enlightening conversation, Dr. Tolu. So thank you so much for coming through.
Thank you, Mrs. President.
Yeah, my Twitter
Madam
handle is
President.
President Zibby. Thank you so much, Dr. Tolu. It's been very enlightening. And, I have to agree with Adiola, our caller. A lot of people have certain ideas of healthcare workers based on the experiences that they've had. And while there are also some good experiences, some have had to deal with not so pleasant experiences. And let's just say you represented your sector really well.
Thank you very much for the kind compliment. Thank you.
Awesome. Well, that is it for Lagos Talks, and that is also it for the Smooth Breakfast. Thank you so much for being here with me. I am back, back tomorrow from 6 a.m. for the Smooth Breakfast. Strictly Soul comes up from 10 a.m. Oluwaseun is standby and waiting to get into the show. Well, have a beautiful, beautiful day ahead.